Hello everyone, and welcome to today's session. Just wanted to check if the voice is clear. Well, today we'll be talking about the importance of hip pain in reference to back pain, and why is it so important to even manipulate or move your hip in the right direction when you have a back problem, or when you have simply have a hip problem. Because while doing spinal manipulations with a lot of patients, they always tell me that, okay, we don't have any hip issues, then why do we need to mobilize the hip? But there's a huge connection between what there's a huge connection between what happens to the back and what happens to the hip, and how it can matter. So I have a lot of people joined in. Thank you very much for joining in, guys. And before we start the session, I would like to inform you that we are coming to Pune from 23rd to 24th, 5th of May. That is this Friday, Saturday, and Sunday. We'll be at Pune at Hotel Kapila Business, Dhole Patil Road. And if you guys wish to meet up, or if you guys want to have an appointment, you can connect on this number, that is 800-673-8000. All right, this is the number for appointment. I will also pin this in the comment section, so it's easy for you to kind of connect and take the appointments. Yes, you can also ask me any questions if you have any questions related to your injuries or your pain, whether it is related to the neck, back, foot, shoulder, any of these areas. You can always send me a message right away, and we can answer it in the live session itself. So talking about the reference when it comes to hip mobilization, or the importance of hip pain and how it is connected with the back pain. So one of the most important thing is that the sacroiliac joint, which actually connects with the spine as well as the hip, is one of the most important joint, which is a connection between the big back and the hip. And a lot of your movements are related to whether it is your walking movement, whether it is the way you stand. It is a lot of it is related in reference to the mobility that you have in your hip. What kind of mobility do you have, whether you have a tight rotator, whether you have a tight hip flexor. This all of these things which will actually change the way you stand, which will actually change the way you walk. For patients who come to me, we actually kind of take them through a very serious kind of postural assessment, and help them understand that typically what is the problem in your posture and what needs to be corrected, so that you can get rid of this pain, as well as get your posture in the right way. Do you know that 90 to 95% of the time, the back pain or the neck pain or even the hip pain that you get, it's basically because of a bad posture, and a bad posture that has been sustained for a very long time. So solution definitely lies in the posture, but it's very important to understand how do we correct it, where are we making mistakes. So we do these sort of customized postural evaluation, which I think every physio must do, every chiro must also do, because once you do that, that's where you come to know what all things are wrong in your posture and how that can be corrected. So Amit has a question which he's asking me: can early stages of plantar fascia lead to hip and back pain? Yes, definitely, because that's a very good question, and that quite goes with the topic. So yesterday only I had a patient who first told me that I have a little bit of tightness in my hip. Okay, and then as he was discussing this, he told me that I have this heel pain for the last 2 months. And now, just to get rid of the heel pain, I'm avoiding my weight bearing on the heel and trying to modify my walk, because of which actually I'm also feeling a lot of hip stiffness now. So the problem is only related to heel pain, but what happens is that obviously when you feel a pain at any part of the body, and especially when it is a weight bearing area, like heel is a weight bearing area, knee is a weight bearing area. So what you would do in order to reduce pain is basically avoid weight bearing. But when you start avoid weight bearing, it is not just for the heel, it's not just for the knee, it is for the whole body. The whole body is now compensating, the whole body is now compromising in such a way that the pain is less, but certain movements are more, certain movements are less, certain joints are working harder, certain joints are resting because you want it to rest so that the pain is less. But then yes, eventually in a long run, what you will see that your gait has changed, the way you walk is changing, your hip joint or probably your knee joint is working harder in order to accommodate that ankle pain. So it's important that instead of doing a lot of compensation or compromising on your gait or your walk, it's important that you get yourself treated for plantar fasciitis, whether it is physiotherapy or with some manipulation sessions. Essentially doing ultrasound also works in plantar fascia, and a lot of stretches for your ankle, which helps to kind of release this thing. Gigi Sara has a question: when will you be in Bombay again? So I think we'll be in Bombay on 1st of July. We are based in Thane and Mumbai. So basically we are here only most of the time. So every Saturday I am in Bandra, and Wednesday and Friday I am in Thane clinic. So like I said, the number for appointment is already mentioned. You can always connect on that number and take up an appointment. Yes, I am open to questions, and you guys can ask me any questions related to your issues or injuries. Yep. YXMNish Manish is asking me when is the Goa camp. So the Goa, we are coming in mid-July. We'll be there in mid-July. Then the same number is for all the camps. If you want to connect us for appointments, you can connect us in the same number for any appointment, whether it is Goa, Pune or Mumbai. All right. So talking about the hip joint aspect, uh, Delhi. Amit is again asking me, will you be coming to Delhi? Yes, we did a camp in Delhi in the month of March at Gurgaon, and now we'll be doing a camp in August. So we'll be coming to Delhi in August. We'll certainly share the dates with you, but if you can follow us on Instagram, you will definitely understand that what is the schedule. Oriston D'Souza has a question. Can you explain about anterior pelvic tilt and posture correction? Yes, of course. Now, like you said, the anterior pelvic tilt happens with the pelvis joint, and a pelvis joint is a combination of three joints. It's like the whole pelvis is the ischium, is the ilium, and the psoas and the sacrum, which all connects together to make a circle kind of thing, and that is what you call a pelvic joint. Okay, so what happens in a pelvic joint? There are different positions. Either you're standing with this position, which is like posterior tilt, or you're standing with the anterior tilt, wherein you tend to have a forward strain like this. So basically in both the positions there is a lot of compensation which is happening to the hip joint. There is a lot of compensation happening to the spine. The spine can get into an exaggeration, or the spine can get into an excessive lordosis. So these are the changes that you will see. Having a good core, or trying to engage your core when you sit, stand, or do any kind of activity, will definitely help you to kind of reduce the problems related to anterior pelvic tilt. So it's very important that you do a lot of bridging exercises. You can understand what exactly are basically they're just pelvic lifts. Okay, so it's very easy to understand. And trying to strengthen your abdominal muscles. So basically if you start doing this, you will certainly see changes with problems that are related to pelvic tilt, anterior pelvic tilt. Okay, Gigi Sara has a question once again. How long after giving birth, normal delivery, can one visit you for low back therapy? If it's a normal delivery, within a month, not an issue. We had a patient only yesterday, who in fact kind of had visited for a lower back pain, and within a month doing this is absolutely fine. If it's a surgery, if you have done so um, we expect you to wait for about 2 to 3 months. But if it's a normal delivery, yes, within a month it's absolutely fine. All right, so that was the question from Gigi Sara once again. And thank you everyone for joining in. I can certainly not call up all your names right now because I can see a huge list. But thank you for joining the live session. And please do put in your topics about what would you like to know in terms of your overall joint position, or understanding your pain, understanding your posture, understanding your workplace, and how important it is to have the right posture, whether you are in your workplace or at your home. So you could always put in some topics which I would love to kind of discuss it here during our live sessions. I do these live sessions mostly 2 to 3 times a week around this time, so Tuesday, Thursdays preferably, so we can definitely catch up and have this thing. So thank you so much for joining in, guys, and this was a brief about hip and the connection between the hip and back, and I also answered few of your questions. Mugdha Shah has a question: any remedies? I have a pain between heel and toe area. Heel and toe area, it's very bad. It's very bad when leg rests for 5 minutes, then I can't walk without. uh there could be two things: either you have an inflammation of the plantar fascia, which is called plantar fasciitis, or you could also check once for varicose veins. If there is varicose veins, so you need to check on that. You need to first rule out what exactly is the problem, and based on that your treatment will differ. Because sometimes varicose veins or diabetic foot can also result with this kind of pain which happens when you wear a footwear. And if it is just an inflammation of plantar fascia, maybe a bit of physiotherapy and some ankle exercises can be done. So if you want to check out our specific exercises for ankle, back, knee, you could also do that on our YouTube channel. We have a playlist where we have exercises for these conditions, and most of these exercises are very simple but extremely effective, and it helps to certainly reduce your pain. uh, Georgie is asking me how to get rid of shoulder pain. I need a little more details on that, because shoulder pain can be due to multiple reasons. It could be more of muscle strain. It could be a ligament strain. It could be a shoulder, a bony injury. So I need to understand if it is just a pain or it is more of a stiffness. So based on that, I can probably give you a little more idea on how to get rid of it. But yeah, in the beginning, maybe just doing some icing, resting the shoulder, and once the pain has reduced, just checking if your range is good, or if you've been able to move the shoulder in a minimal or the basic range. If you can do that, if you can sustain that for a while, that will definitely help. So do some icing, maintain the basic range of motion for the shoulder. All right, so thank you, guys. Thank you for joining, and once again, we are in Pune from tomorrow onwards. Friday, Saturday, Sunday will be available in Pune for our camp at Dhole Patil Road, Kapila Business Hotel. So 800-673-8000. That's the number for appointments. You can put in an appointment. Okay, Arshia Gupta has a question. Right shoulder pain will increase if I continue to lift weights, snatches, overhead presses. Okay. So Arshia Gupta, if you have had an injury with overhead presses, and and now you are again trying to work that out or try to exercise it, maybe what you could do is try alternate form of workout for the shoulders. Maybe you could go with exercises which are just 90 degrees, at 90 degrees level, so you don't have to go with overhead shoulder exercises for a while. Give your shoulder joint a break and just do these basic 90-degree level exercises. Avoid shoulder presses, avoid overheads for shoulder with weights, because that's where it's going to kind of increase your pain. Okay, that's one thing. Also, you should look at some stability exercises. With shoulder, we always look at mobility exercise. Okay, we don't look at stability exercise. Shoulder also needs a stability more than the mobility. So stability exercises are like planks. You could do planches, you could do a lot of exercises where you are trying to support the shoulder and also doing the lot of weight bearing on it. So these are basically stability exercises, and this should really be done. I'm a physiotherapist, Mugda. Mugda's question is, wow, which type of doc is good for me, as orthopedic or some other special? You can look at a physiotherapist, Mugda. Yes, a physiotherapist will be helpful for you. What exercises should be avoided in sciatica? Forward bending with weights, forward bending and lifting weights should be avoided. Balwani Kiran has a question. What exercise should be avoided in sciatica? If you're going to gym, avoid lifting weights and trying to do forward bends, especially. Okay, so that's something which you should be avoiding. Yeah. Okay, so thank you so much once again, and all the questions that we have had now, thank you so much for answering. And I have missed a few questions, and I'll answer that in the next live session. So thank you for putting up these questions, and let's see you at Pune. Thank you.